Hello and welcome, everyone. Thank you for joining us for our March Choices Community of Practice Coffee Chat. The topic for today's coffee chat is state and local policies for incorporating added sugar warning labels on restaurant menus. My name is Molly Garrone. I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health, and it's my pleasure, as always, to be moderating today's event. I would like to acknowledge our funders who make this work possible and share that our choices work and events are only for research and educational purposes. The intention of today's coffee chat is to provide information, tools, and resources to inform and educate. We are not looking to influence any specific legislation. I also want to note that our guest speaker has been invited to share personal perspectives and does not speak on behalf of Harvard. If you are unfamiliar with the Choices Community of Practice, we are a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. We aim to support these efforts by providing tools, resources, and trainings. Our coffee chats are unique, regular opportunities to share ideas and enhance connections in an informal setting. Today, we will start by hearing a brief presentation from our speaker, and then we'll open it up for a full group discussion and Q&A. We encourage all of you to share any questions or comments in the chat throughout the event. Many fast food and fast casual restaurants serve foods with high levels of added sugars, fueling excess consumption among Americans and contributing to the development of chronic diseases. For today's coffee chat, we will be focusing on strategies that have been used to incorporate added sugar warning labels into restaurant menus to reduce added sugar consumption. We are pleased to be joined today by DeAnna Nara, who will be highlighting resources to help practitioners at the state and local levels better understand this strategy. DeAnna is the policy lead for the Center for Science in the Public Interest state and local food labeling and marketing work, specifically focusing on initiatives to improve food environments by reducing sodium and added sugar consumption and implementing strategies to reduce unhealthy marketing of foods and beverages. She is the chair of the DC Board of Nutrition and Dietetics and is also a licensed dietitian nutritionist and certified nutrition specialist. Prior to working at CSPI, she served as a policy advisor and public health nutritionist for Terrific Incorporated, a nonprofit housing and human services organization, where she advised DC policy for managing chronic disease for at-risk older adults with low socioeconomic status. As an Edward Alexander Boucher Doctoral Fellow, DeAnna earned her PhD in Nutritional Sciences from Howard University, a Master of Science in Herbal Medicine from the Maryland University of Integrative Health, and graduated Phi Beta Kappa with a Bachelor of Science in Psychology from Howard University. So welcome, DeAnna. It's really great to have you with us today. We're looking forward to hearing what you have to share, DeAnna. And so I'm going to go ahead and pass it over to you to get your presentation started.
Thank you, Molly. So first, I'll just introduce my organization, Center for Science in the Public Interest. We're a nonprofit with a consumer education and advocacy mission that envisions healthy communities and people supported by equitable, sustainable, and science-based policies, specifically on nutrition, food safety, and health. We've been behind some of the key federal policies that have shaped our food systems, from restaurant menu labeling to school meal nutrition standards, and also the update of the nutrition facts panel. So we'll just kind of briefly level set us with the need for these types of food environment and consumer behavior policies. So neighborhood and community food systems, as we know, play a major role in how people actually interact and engage within the food systems. Places like grocery stores, convenience stores, and restaurants are all part of these many different food systems that people are purchasing from and eating from. And as they generally interact with these environments, other factors such as learned food preferences and the social environment all impact our purchasing choices within these actual systems. Policies that address labeling can help enable healthy preference learning, can help overcome barriers that actually limit those healthy preference developments, and actually encourage people to reassess directly at the point of sale and purchase, and help to promote a food systems approach. And as Molly hinted to, restaurants play a major role in food systems across the United States. And we know that the restaurant industry is feeding a meal to more than 1 in 3 Americans every day. There are over 300,000 chain restaurants in the US alone. And the context for these types of food environment policies is that these particular companies and industries, particularly fast food and fast casual restaurants, are promoting and normalizing foods and drinks with exceedingly high levels of added sugars, amounts that are far exceeding the FDA's recommendations for consumption. We also know that these are linked, general overconsumption of these are linked to increased risk of chronic diseases. The average default fast food combination meal in the US contains 68 grams of added sugars, which is 136% of the daily value for added sugars in just one meal, with most of this added sugar generally coming from fountain drinks and other beverages. We know that consumers have a lack of awareness regarding the amount of added sugars contained in menu items. And in fact, no one can tell how much added sugars is in these items because the FDA has not yet required this information to actually be disclosed for restaurant foods. We also know that these types of fast food restaurants and chains are disproportionately located in under-resourced communities, with predominantly Black and Hispanic communities facing higher exposure to fast food, which we know is a product of residential segregation that is rooted in historic policies like redlining, disinvestment, and targeted marketing. And nutrient warnings as a general one of these contributing solutions. So we know that nutrient warnings are disclosures that can be considered a form of nutrition education. They can appear on menus, menu boards, food labels, and on the front of packaged goods. And these provide very easily interpretable information to consumers about food and beverage items that contain excessive amounts of harmful nutrients like added sugars. These types of warnings are objective, accessible, they're also widely supported, and they can help individuals identify and avoid foods with excessive amounts of sodium, added sugars, and other nutrients that were recommended to limit in diets. Policies that actually require warnings on foods and beverages that are high in sodium and added sugars start to benefit community health by nudging people towards healthier choices, increasing access to information, encouraging healthier food purchases, and actually pushing companies to reformulate their recipes and products. And in this sense, what we see is that these types of industries will reformulate to actually avoid putting the warning on the menu so consumers are benefiting without having to do anything. These also help to address the misleading effects of marketing practices that are misrepresenting, again, the healthfulness of these foods and normalizing this extreme overconsumption. And warnings like this will generally kind of go through a quite brief history of US in the US of these kinds of warnings. But warnings like this have continued to grow precedent. Two cities, New York and Philadelphia, already have similar warnings for sodium. So if you live in either one of those places, you may have seen these on the menu. And most recently, New York City enacted legislation for added sugars warnings, which I'll talk about briefly in a moment. The New York City warning in particular was very precedent setting. In 2015, the health department adopted a sodium warning icon on restaurant menus for items containing more than a day's worth of sodium. That rule was challenged in court by the National Restaurant Association. The city actually won that challenge, and the restaurant industry declined its appeal, which actually left that warning in place. Philadelphia then followed suit in 2019 with a similar icon, this one particularly going through the city council as opposed to the health department. And I'll talk more about these pathways a bit later. This warning also adopted the text sodium warning behind the icon, and you can see here an online menu from Taco Bell that shows both the warnings for the same New York City's icon only and Philadelphia's icon plus text. These warnings are allowed because they fall into a category of safety warnings. Federal law preempts states and localities from actually requiring their own nutrition labeling on foods sold at retail or in restaurants, but leaves an exemption for safety warnings, which is why cities are allowed to do this. There's an additional option to pass a local rule and then petition FDA for a waiver. And Philadelphia actually attempted to do this in the first place to actually pass this local sodium disclosure on menus in 2011 and did apply for a waiver, but ultimately passed the policy through council because the waiver was never acted on by the FDA. And in February 2022, CSPI, we actually worked with the Philadelphia Health Department to submit a petition asking FDA to make this particular process easier. That petition is still ongoing and that docket is still open without action. We know that fast food menu calorie labeling has also been shown to be an effective and cost-effective solution, and as a form of nutrient warnings. So the Choices team actually recently published a peer-reviewed publication about this, and has some accompanying resources that you'll see in the chat. So on to the Sweet Truth Act campaign in New York City. So over the course of a 3-year campaign, we worked with community members and advocacy groups to organize and build a coalition of more than 180 faith groups, small businesses, and community-based organizations, as well as over 150 medical and public health groups in New York City. The coalition worked with co-sponsors, Council Member Keith Powers and Lynn Schulman, which resulted in the City Council passing this particular bill in 2 phases. The first being an added sugars warning on prepackaged menu items in 2021, and the second extending coverage of these warnings across the full menu on November 2nd of last year. These bills in combination serve to form the first community-led added sugars disclosure policy of its kind in the US. But unfortunately, this victory is bittersweet. Due to the lack of federal requirements for chain restaurants, as I mentioned earlier, to disclose added sugars information, the city decided to tie bill implementation to the updating of FDA regulations that would actually require restaurants to disclose added sugars. So some of those items will be covered now using information from the Nutrition Facts Panel on prepackaged foods, which include the added sugars line. But the full impact of the community's work and desire to improve the health of New Yorkers won't be seen until FDA acts. These developments have added urgency to FDA's work in reducing added sugars in the US food supply, and the agency now has a very key opportunity to act in support of New York City communities, as well as other communities that seek to address added sugars in restaurant meals. We also petitioned FDA to require restaurants to disclose added sugars content of their menu items in January 2022 as well, and have not received a final decision yet. We do continue to push the agency to act quickly to ensure that everyone in America has access to the information that they need to make these healthy, informed choices for themselves and their families. And just passage of policies like this, Sweet Truth, is a direct example of how these types of state and local policies can help to push federal agencies to move on improving public health, and in doing so in a timeline that is quick. And just highlighting a bit more of the work on the federal level. So again, we're speaking about getting added sugars included in the nutrition information published in restaurants. The general context for this is that in 2014, FDA implemented the menu labeling requirements of the Affordable Care Act by publishing its rule for menu labeling in restaurants. This includes the requirement that restaurants publish calories on the menu and make additional nutrition information available on request. These rules actually rolled out 2 years before the Nutrition Facts Panel update, and that panel was actually amended in 2016 to require added sugars disclosures, which most of you, I'm sure, have noticed on the Nutrition Facts Panel, that little added sugars line. So as a result of this kind of missed opportunity and loophole, restaurants are currently only required to publish total sugars and not added sugars. There are, however, a handful, and now that handful keeps growing as we've noticed passage of the Sweet Truth, which now includes McDonald's. They are voluntarily already reporting added sugars, but most, again, don't disclose this information. So we always see that when these policies pass and go into effect, industry generally will fall in line, and they have started to do that with added sugars. Some were already reporting before the passage, but we've now noticed that more are falling in line. And this just covers a bit more information about the petition. So again, in January 2022, we petitioned FDA to actually update menu labeling to require a declaration for added sugars. We worked on this petition with Consumer Reports, as well as Dr. Jason Block. So benefits of this kind of update, we know that this adds new information into the public domain. We included some examples, which you can see on this screen, in our petition. So this pineapple surf from Smoothie King, which voluntarily labels for added sugars, and a comparable product with Jamba that has less total sugar. But we really have no idea how much of it actually comes from blended fruit juice and how much of that is actually added sugars. And then finally, we know that it supports public health research and supports policies that are aimed at added sugars reduction, like the Sweet Truth Act. And so we know that across the board, there has been a growth of national and federal campaigns. So passage of this New York City Sweet Truth Act has started to help advance a national network of state, local, and federal advocacy campaigns. We are currently working on New York sodium and added sugars bills statewide. And this is added sugars warnings on chain restaurant menu items that have more than an entire day's worth of added sugars or more than 50 grams, or sodium, which is more than 2,300 milligrams. Also working on sodium warning policy in Cleveland, Ohio. And this is a sodium warning policy on all restaurant menu items and all restaurants, not just chain restaurants, but those that have more than 1/2 day's worth of sodium. So the warning is coming in at 1,150 milligrams. And this is the first policy that we are kind of experimenting. But this, again, this policy was built from the community up. So the community actually worked with the health department and a large coalition that was built. We are doing this with Center for Black Health and Equity. And that coalition listened to what the needs of the community are. So knowing that high blood pressure and heart disease are a major issue, particularly in Cleveland and particularly in these under-resourced communities. We know that they wanted to target the warnings at these, and also we know from the health department, working very closely with them, that these particular chain restaurants do exist in Cleveland, but in their particular jurisdiction, they're actually other restaurants outside of chains. So general mom and pop or single restaurants that have maybe 2 or 3 chains. That actually were more prevalent. So we designed that policy with the community in mind, and that is a very exciting policy. Has not been introduced yet, but will be very shortly. We're also working in Massachusetts on an added sugars warning bill that is statewide. This is an omnibus bill with a couple of other food environment policies, but particularly this is added sugars warnings on chain restaurant menu items as well that have more than a day's worth of added sugars. And that particular bill is actually aimed at protecting youth from the harms of sugary beverages. And we know that youth, in the research, we see that youth are not only being marketed adult meals and value meals more prevalently, but are also consuming those. So utilizing these added sugars warnings to help them to make these healthier choices. And it's things that they can actually understand. As a mom of 2 teenagers, I can definitely vouch for the understanding of icons.
Thank you so much, Deanna. That was such a wealth of information. And I really appreciate that you spent so much time highlighting the important problem of added sugars, and particularly with respect to restaurant menus, and just talking about all the different momentum that is going on, nutrient warnings, how they can be a great solution. And I think in particular, really helpful to hear you discussing initiatives like the Sweet Truth Act, underscoring the potential for state and local policies that can contribute to improving public health nationwide. So thank you so much for that great picture. And also thank you for all the resources. I did want to remind folks, thank you, Stephanie, on our team has been putting a wealth of great resources in the chat. If folks are not familiar with this, we usually share out a resource roundup document afterwards that has all of these resources and more listed. So if you haven't been able to capture all those, just a note that we will be providing that after the coffee chat. So fantastic. Well, thank you again, Deanna, for the presentation. And I think at this time, I'll move us into our Q&A and group discussion portion. And I'm going to kick it off with a question. I wondered if you could expand a little bit more, Deanna, on the distinction between nutrition labeling and safety warning labeling.
Sure. So in 2014, FDA implemented the menu labeling requirements as part of the Affordable Care Act, as I mentioned, by publishing its rule for menu labeling in restaurants. This generally includes a requirement that restaurants actually maintain general nutrition information, which includes total sugars, carbs, sodium, saturated fat, and the publishing of calories on menus that are available again on request. We also have nutrition labeling on packaged foods and beverages with the Nutrition Facts Panel, which was most recently updated in 2016 to require that added sugars disclosure. So now, when you look at the Nutrition Facts Panel, we see that added sugars line. Safety warning labeling is the process by which states and localities can actually require warnings that actually concern the safety of the food or the component of the food. So while they're in a category of safety warnings, we know that they're still considered a form of speech. And so cities and states that actually require warnings need to take steps to avoid violation of First Amendment. And that includes steps like making the warning factual and uncontroversial. So that means avoiding placing any unnecessary burden on industries, so keeping the warnings at a reasonable size. And also, we know that in the case of nutrients of concern, like we've been talking about added sugars, we actually turn to the Dietary Guidelines for Americans, which provides factual federal guidance for consumers to actually limit these nutrients at specific thresholds. So we can lean on those thresholds to actually look at the thresholds, and that is the established safety warning coming from federal guidance. So we're able to utilize those kinds of warnings in kind of tandem with federal guidance.
Super helpful. Thank you for clarifying that. And folks, if you have questions for DeAnna, now is a great time to ask those. So feel free to come off mute and ask your question, or put questions in the chat. We really want to hear from folks. So while you're thinking about questions you might have, another one I have for you, DeAnna. So if, like, what would be some first steps that a state or local health department could take to explore this work? Who would need to be involved? Who are some of the key partners? Can you walk us through that a little bit?
Yeah, so one of the things that I would encourage is to engage with groups like CSPI, who are actually leading implementation of these types of policies across the United States. And in that sense, is that we can help to provide technical assistance to help to create a roadmap for successful passage. A great reference to start with, and I think it was already dropped in the chat, is the Nutrient Warnings Toolkit. That is a great kind of summary of all of the things that you may consider. And it really generally looks at how you want to explore the strategies. So, like as I mentioned previously, health departments in New York City were able to go ahead and pass that first sodium policy through a rulemaking. The other option is through City Council, which was what Philadelphia did. When you consider each one of those options, there are several different things we would suggest considering. So, if we're going through the health department, it is still advisable that you work with community, but really having the political buy-in is very important across. And I know everyone who's on this call and who is at health departments knows what that means. But making sure that it is of interest. It is much harder to push these policies, I think, when there is not a lot of interest in the policy. But most of that comes from just not knowing about this policy, hence the poll in the beginning, which most people aren't aware that health departments can actually do this on their own and do this through a rulemaking. And so I think just considering what those options are and then how they work. And we have been now doing this. This has been going on 4 years working on these particular added sugars warning products policies. So we have a wealth of information to happily share to help you get started.
Awesome. Thanks, DeAnna. And thanks for highlighting the nutrient warnings toolkit. I put another link to that in the chat, so folks can take a look. I'm also wondering too, so you were touching a bit, I think in your presentation, on some of the health disparities around this issue, and I'm curious how this strategy could impact or even improve health equity.
Yes. So we know that nutrient warning policies generally help to equip consumers with nutrition information to encourage healthier choices, and actually push these companies to improve healthfulness of these products. And while neither of these particular outcomes deal with structural barriers that actually reinforce and widen these types of health disparities, mitigating these types of disparities requires this coordinated change and help impact food choice. So while we know that these kinds of warnings are not addressing those structural barriers, they can carry these important public health benefits. And what we like to do is to try to design them to maximize inclusive participation in their designs, similar to how I mentioned how we're working with Center for Black Health and Equity in Cleveland. So we always want to try to ensure that these warning labels are utilized across many diverse populations. And the goal is always to prevent these types of policies from actually exacerbating health disparities. Nutrient warning policies can actually include communities that have been negatively impacted by prior food industry marketing. And again, this very targeted food industry marketing of unhealthy products. And we know that we can design them to ensure that they include communities that are most unjustly burdened by these health disparities. They also apply to fast food restaurants, which, as I mentioned previously, are disproportionately located in under-resourced communities. And again, we know that this can help benefit these communities by covering these food environments that present the greatest harm to communities. We know that they also can design warning policies to include those little icons, which you could probably saw on the slide previously, but you'll also see it in the toolkit. But icons. So icons are a very relevant and accessible way for people to understand and see and utilize. We also know that research shows that non-English speaking parents, as well as Latino and Hispanic parents, have found these warnings to be equally as effective in their use.
Great. Thank you, DeAnna. And thanks for highlighting the kind of community engaged mechanism that can be employed in this. That's great to hear about. So folks, keep thinking if you have questions we want to hear. I have one question here. In New York City, what might consumers expect to see before the labeling on menus goes into effect with FDA action?
Yes, so generally how that policy was set up is the first warnings are going to start appearing in 2025, and they will be appearing on prepackaged items of June of next year. And so those warnings will be on like bottled sodas, anything that has more than an entire day's worth of added sugars that are in a prepackaged item. The next phase of that rollout will be December of 2025, where we will see warnings on menu items that have a prepackaged likeness. An example of that is fountain drinks, right? So we know that when they get those syrups have generally nutrition facts panel information or information that can be garnered from the added sugars warning label. And so what that will show is anything that has a prepackaged likeness that the health department can refer to obtain that added sugars information, those menu items will receive a warning. All other menu items will then be covered after FDA establishes this particular rulemaking, forcing restaurants to report added sugars, which we always are pushing the FDA and encouraging them to do this in a timely fashion. And we have been utilizing, as I said, this campaign and several others of our campaigns to expedite this timeline. We do think it's really important that people do know how much added sugars they're consuming when they go into a restaurant. But this particular mechanism will be in place, hopefully along the same timeline as FDA gets their act together. But we know that these warnings will definitely start appearing next year, and then hopefully FDA will follow suit. If before that would be nice, and if they do that, written in the bill is that this particular thing would apply then to all menu items. So if that rule were to take place, that rulemaking comes out, telling restaurants they do have to report added sugars. If that aligns with that timeline, then it would cover the entire menu immediately. But until FDA fully discloses and puts that rulemaking forth, we are still waiting.
Great. Thanks for clarifying, Deanna. So I do have a question here from Unity. Thanks for this question. What are some common barriers you see when going through this process?
Depending on which process you go through, I can start with City Council because that is the process that we just recently went through in New York City. And like most of you on this call who are policy makers and advocates know, industry opposition is always something that we have to deal with. Political will is another thing. But I think that those two were, in that sense, the biggest opposition. We got most of our opposition coming from Coca-Cola distributors who actually did not want to see this on fountain drinks. So that's why you see we had a two-phased passage of this bill. We came in the first time, passed it on prepackaged items, and that was because of industry interference, literally at midnight the night before it was going to pass, to not want to see these warnings on fountain drinks. So they didn't care about the prepackaged items and knew that that wouldn't be, in a sense, affecting this particular distributor in New York City. And so that's one of the bigger things. But what we found is that if you are able to work with community organizations and really develop a large coalition and interest within the community to show that these are things that are benefiting and something that people want, that was much louder than industry opposition. And so I think the biggest barrier there was that, and then the second barrier was, FDA, right? So we would have loved for this to go into effect. And I will mention that the state level policy that I did mention earlier for New York State, that would actually that bill language is actually still tied not to FDA passage. So that bill language would actually immediately put added sugar warning menus in place without going this FDA route. And when I talked about that political will, that was what that was. That particular jurisdiction and locality had dealt with some lawsuits from a previous speaker's passage of some bad laws. And so they didn't want to take any chance of having any lawsuits, even though they would win the lawsuit, because again, we're coming in at this safety warning perspective. They did not want to take the chance of that. So I would say that political will and industry opposition, which are generally the two things we see most in this field, especially with sugar, still are the two most challenging things.
Thanks, Deanna. That's helpful to hear. I have another question here, kind of more about communities. Have communities done other activities before moving on such policies? So like education campaigns or awareness raising?
Yeah, so the way that we have worked with communities in the past is we start with that nutrition education component. So, really educating people within the coalition about what added sugars are, right? So, what added sugars are, where they're found in the food supply, where we're as consumers consuming the most of these products. And we really start from a root of really expanding that education throughout the kind of coalition that we're building. As a licensed nutritionist, I do a lot of that. I'm thankful for virtual Zoom, so we can work all across the United States with nutrition education classes for the community members and coalition members, which is also how we can build the policy. So once people, and honestly, I think that is a big foundation because a lot of people don't know what added sugars even are. And I think that, this big kind of black hole of total sugars, people don't realize that total sugars are including fruit sugars, sugars from milk, not just the ones that are added during processing. And so I think the biggest component there is really looking at educating. The other thing that jurisdictions have done is before that policy gets rolled out, they do a community education campaign. So in New York City, they spent money on transportation campaigns about the sodium warnings, about kind of what they look like, where they'll be. And so they really did a great public education campaign. And as far as before rolling that out, which we don't know what their plans are. Again, this just passed in November of last year for added sugars. We don't know what that necessary kind of plan will look like. The other part that happens here is that the city also is required to educate workers, right, of chain restaurants, so chain restaurants in general. So they provide kind of general guidance and classes to these particular chains to help them to understand. So those that are even working in these environments get exposed to that information as well, which is also beneficial because we know a lot of the times people who are working at these chain restaurants are consuming a lot of these foods. And so it's kind of a more trickle down impact of that particular education. So really rooting the entire thing in nutrition education is definitely part of that. And again, we utilize this to also, we talk about other things in these kinds of menu items and just intake of nutrition in general.
Great, thank you. You mentioned that some companies are doing this labeling voluntarily. What can we learn from that work, in your opinion?
I think As very similar to what we saw with the sodium warnings, once industry knew that this was a policy that was moving, and also people started to realize the health impacts. And I think that, we know that overconsumption of added sugars contributes to type 2 diabetes and heart disease, in part by leading to weight gain, and are also linked to higher risk of dental cavities and caries. So we know that there is, this intense, contribution to health outcomes. And so I think that, we've learned that, generally focusing on trying to push companies to respond to what consumers want is something that we've seen effective. So, as I said, we always are tracking chains that are actually reporting added sugars. Some of the early ones again included like Baskin Robbins and a couple of others, but now that list is growing. And after the passage of Sweet Truth, we saw McDonald's jump in. So once we saw McDonald's jump in, we know that they are now starting to understand that people do want this information. People would like to know how much of those sugars that they're consuming are added sugars. Really importantly, because a lot of people are managing chronic conditions and going into a restaurant and wanting to know what that information is. Again, not having that information about added sugars doesn't give someone with type 2 diabetes or heart issues any information about how much of that total sugars is actually added sugars. So they could be thinking that they're making a really healthy choice by, again, drinking something like a smoothie, but not realizing that those total sugars, 80% of that is added sugars and not sugars coming from fruit. But we think that these policies are really starting to push chains to do this, and that consumers want less sugar. We know that in polling across the nation that people are looking to reduce their added sugars intake, and that these kinds of policies are really informative. I think it just gives people the awareness. We're not telling people what to do. We're not telling you, don't do this, don't drink this. It's not like the big gulp ban in New York City. It's generally giving people access to the information and allowing them to make those choices for themselves and their families. So, really just providing that information.
Thanks, Deanna. That's really helpful framing. I like the way you phrased that at the end there. So what incentives can restaurants be offered to include labels on their menus? What would kind of like lower the barriers for them?
Well, mostly, there's not really many incentives that you that you can get restaurants to do many things that are healthy. I think the incentive should be community health and should be contributing to the local communities that they themselves have placed themselves into, and contributing to the health generally of those cities and states. There are not many things that we have found that incentivize industry to do things that are healthier, other than being forced by policy or rulemaking. I think generally as we, continue to see the health of, just generally in our country and the impact of chronic conditions, and knowing that we have now generations of children who are outslated to not outlive their parents through chronic diseases and conditions, that should be motivating enough for them to want to make changes, and to market healthier foods to these particular really vulnerable groups. But we see from evidence that they are not interested in doing that. And so, as a community and a country and a city and a state, we have to generally push them to see those incentives. And it's, I always say, kind of similar to gas, oil, and tobacco, where they kind of show that they're doing certain things in communities and will contribute to communities in ways that are positive, but then we'll turn around and market, 80% of unhealthy items. That 80% of their marketing is unhealthy items when they could be, improving their menus. We've also seen that during COVID, some of these chains started to offer healthier options, and those are now falling off the menu again. So, it's kind of falling back into this like status quo, like business as usual. Oh, we were trying to be healthier, but now we're going to just jump right back on the same bandwagon. So, I think, it should be the incentive of improving community health, and kind of offering things that are reasonable. I mean, there's no reason to be giving people, I mean, my favorite option is the most recent example is the Dunkin' Munchkin drink, which I'm sure many people on this call have heard about, but having over 120, almost 2, 3 days of added sugars in one beverage is just not necessary. So we know that these are steps that they can take to do these things to improve health. There has been discussion among kind of smaller businesses and smaller restaurants as we think about these more local restaurants. And a lot of the times, those and in our coalition building, those restaurants are actually very willing to participate in these kinds of policies because they're linked to the community and because they understand that that kind of health and those places and spaces that they're offering to communities to eat and to be nourished can be healthier.
Thanks, Deanna. And yeah, thanks again for just echoing the importance of the role of community in all of this, as is often the case with so many things in public health. From the decision maker standpoint, what sort of messages are you seeing resonate well with decision makers?
So in a sense of like legislators or
Yeah, so like what kind of messaging could people use that would resonate well with decision makers? What have you seen that's kind of been working well?
I think honestly, people are generally immediately shocked when they do realize how much added sugars are in menu items. Particularly, we like to highlight, and I know earlier was dropped in the chat our sweet excess report, where we see these fountain drinks exceeding, even at their smallest size, more than an entire day's worth of added sugars. So generally, those points just pointing out that information, we had a really successful campaign where legislators actually had to take a quiz on a couple of different menu items, and people are blown away by the amount of added sugars that are in some of these menu items. I think the other point is that some of the menu items that people think are healthy, like oatmeals and salads, some of these are approaching or going over this 50-gram limit of added sugars when people are making these healthier choices. And so generally, I think it doesn't necessarily take much for them to kind of jump on board and to understand because they also understand. I think pointing out where these chains are located and the disproportionate kinds of targeted marketing and advertising that are happening for these particular really sugary products. Once we're able to present those things to them and to really show that, I would say in every state and locality that we have worked in, people want to be healthier. They want to have the chance to be healthy. And so I think, that should resonate with legislators. And I think constituents have shown legislators that they do want healthier options, that they do want to have the opportunity to be healthy. And so I think those have, in most of the campaigns, been the things that have pushed them the most. But a lot of it is really, as most of you here have never heard of these policies. And so I think that, elevating these policies that they do exist and the legality of them has been something that has been really beneficial.
Great, thank you, Deanna. So, folks, we're getting kind of close to the end of our session here, but we really would love to ask you to share in the chat something that you're going to take away from today. So, Deanna has shared so much great information and insight and resources. So, maybe something caught your eye or caught your attention that you're going to take away and read more about or learn more about after this. So, please feel free to share those thoughts in the chat. And while you're doing that, I have one question for you here, Deanna. So obviously CSPI is a great resource that folks can check out, but are there other resources or groups or things that folks can go to learn more about this kind of work?
Well, we are kind of leading the charge in this space. I think that there are a couple of other spaces and places that you may find information on nutrient warnings in general. There are a lot of, and I think have been dropped in the chat, research that is going on the use of warnings and nutrient warnings generally. But as far as moving these types of policies, again, all of the references that you all have dropped in the chat and resources in the chat are generally, again, this is a very new policy, which is really, really exciting. And as I said, the first one fully passed last year. So there's not too many groups that are actually kind of leading this. That is our goal, though, is to reach out to people like all of you on the call, to educate people about this, that this is an opportunity for health departments and for also city council or councils, state, locality state and local legislators to be able to implement these changes. And so I think, this policy again is very new, so not too many, general resources of people to help. I will mention we are working with national organizations like Center for Black Health and Equity and Interfaith Public Health Network, which are both very familiar with our work, as well as American Heart Association. And so, again, we are continuing to build and also welcome anyone on this call who is interested in learning more or interested in being at the table, especially if you fall into any of those states and localities that we discussed. We always want to make sure that we bring many people to the table. We just had a call yesterday with a group that actually works with people with developmental disabilities, and they were saying that how important these icons are when they're teaching people how to, live and manage all of the ideas about nutrition. So the dietitians and nutritionists have been teaching them and utilizing these kinds of warnings as a nutrition education tool. And so we also know that they mentioned that these kinds of labels can be so important and would be so important for foster kids. So they work with a lot of foster children who actually can be moved through the system and have access to many different types of nutrition literacy throughout the spaces and places that they go, and often will be exposed to fast food. And so using these as some of those tools, they believe are going to be really helpful, specifically in New York City.
Fantastic. Thank you, Deanna. Great way to wrap things up there. And I want to highlight, thanks, Carla, for sharing in the chat, just the learning the awareness of these policies, being aware, showing policymakers the amount of sugar in products. It's a great strategy to bring about this awareness. So great note to close on there. I'm just going to share a couple notes here before we sign off for the day today. But as always, we like to ask folks to share any ideas that you might have for topics for future coffee chats in the chat. So feel free to do that. And we do have more information available and resources in our Community of Practice online portal. So you can register. It's free to join our Community of Practice. So feel free to do that. We'll pop a link in the chat. And I'd also like to just mention to folks, we have a little post-event survey that we like to ask folks, and that should kind of just pop up on your screen when you leave the Zoom meeting today. So feel free to share your feedback or any insight about your experience today with us. And as a reminder, we will be sharing the recording from today's session and a document with all of the great resources shared. So you'll want to be on the lookout for that. And I want to welcome folks to join us for our next coffee chat. It's going to be on a Tuesday. We typically hold them on Thursdays, but it's going to be on Tuesday, April 30th at 1 p.m. Eastern. So I hope folks can join us again for that opportunity. But we really want to thank you, Deanna, again, so much for your time. Appreciated having you coming on today and sharing so much insight about your work and all that you're doing at CSPI and all the great insight and tips and resources. So thanks again, Deanna, and thanks everybody for coming.
Yes, and Katie, I see your comment in the chat. Please feel free to email me. My email is in the Zoom chat, and I would be happy to work with you to connect you to some of the social media and other things that we've done.
Fantastic. Thank you, Deanna. Thanks, everyone. Take care.